Hey everyone, welcome to A Side of Social Justice, the podcast where we talk about real issues that impact our communities.
This season, we're focusing on mental health and why getting help isn't always easy.
We're looking at the challenges people face when trying to get support.
From stigma and cost to policy gaps and unequal access in different communities.
Throughout the season, we'll be talking with local mental health professionals to better understand how care works, what barriers exist, and what can be done to improve access.
Hey everyone, and welcome to another episode of Social with the Side of Justice. I'm Harmony.
And I'm Mayana, and we'll be your host for today's episode.
Today we will be joined by Ms. Robin Cohen, Director of Integrations and Partnerships at Soluna.
Thank you so much for joining us here today.
Thank you both. I'm very excited to be here with you today.
Yes. So what exactly is Soluna?
Soluna is a platform that connects young people to tools and content that help them understand more about their own mental wellness and gives them a chance to chat with a coach or a counselor on their own terms and engage in our moderated peer community. It's a resource that you can use when things feel heavy and before they escalate.
So how did Soluna get started?
So Soluna is delivered by Kooth Digital Health, which is a company based in the UK with over 25 years of experience delivering digital mental health services. But the app Soluna got started in California in January 2024, and it was built in partnership with young people.
Were there any challenges in creating the app?
So while I wasn't necessarily involved in creating the app, I know that our teams worked very closely with a few hundred young people, and I'm sure they had lots of great ideas that needed to be prioritized. So I can see one of the challenges being figuring out what we are going to focus on first based on the feedback from the young people we worked with.
So when you say young people were involved, like, what does that mean? Like, were they involved with, like, the designing or, like, maybe, like, basically things that work for them that they want to see in the app?
Yeah, that's a really great question. We were using that time with focus groups, so we were doing some interviews. We were giving them space to see the design. So you might notice the dark, starry night theme within the app. That was all designed by our product team, but under the influence of all the young people saying, we'll most likely use this at night and want it to feel really soothing.
Oh, I like that.
Why did you choose to get teens involved?
I think it's really important to ensure that young people are involved in something they're going to be using. We don't want to put something out into the world that maybe we as an elder millennial think is the most beneficial for you. So we wanted to make sure that young people had their voice included in the process. So we were really creating a product that was for them.
So where is the app based?
So the platform itself is available to states that partner with us. So I personally work in Philadelphia. We have headquarters in Chicago. So we have teams across the country and in the UK to support this global initiative.
Is Soluna free in every state that you partner with? And how is Soluna offered at no cost?
Yes, so sometimes the free can be a little confusing. It's because the state has paid for the services already, so it's free to the young person and their family at the point of service. So anything that you might want to explore, whether it's our content tools, the coaching, counseling, or the community, that's all going to be at no cost because the state foot the bill already. So that's why it's at no cost to those states that have signed partnerships with us.
So for the process for the states that you partner with to, so the app can be available at no cost. Like, how did that process look? Was it long, or was it like a lot? Was it tedious?
Yeah, so we have a team dedicated to those conversations. It could take 6 months, it could take a year, really trying to understand how states operate and also where we would fit into that existing system, because we want to be able to support what's already in the states that we're partnering with to be a mutual fit.
Do you guys reach out to different states, or do they reach out to you?
That's a great question, too. We are always looking for opportunities to engage with states who are interested in improving the mental well-being of their young people. So we're always looking for states who put that in their vision or mission for the upcoming year. And hopefully down the line, once we've secured more of a presence in the states, we hopefully will have some coming to us as well.
Okay, so your role is Director of Integrations and Partnerships. So what do you do? Like, what's a normal day for you?
So right now, a day could be in the field. So like I'm here in Long Branch, there are some opportunities for me to talk with other adult stakeholders in the state. So there was an event I was at last Friday. I'll be at an event next Monday, just talking to folks and building their awareness about the support that we offer and give them a chance to ask questions too, just like we're doing today.
Very busy day.
What made you want to go into mental health?
So I love this question because I actually started out as a high school math teacher. I taught in Brooklyn for 7 years, and then I saw my own students were struggling with everyday challenges that were keeping them from succeeding in school. And so I had a full room of students every day at lunch, and I was like, I just like talking with them and helping them navigate their day-to-day. So I thought, why not flip the script and go into mental health and well-being so that they will hopefully feel more academically confident in the long run. And by being at a company like this, hopefully I can support more people than just the 100 students I saw each year.
So, you said, like you just said, you really like to talk, especially like get out there. So would you say that's your favorite part of the job, or do you have like something else that you really like to do?
No, I think being in the field talking to people, everyone I've met in New Jersey has been absolutely wonderful and really passionate about the well-being of their communities. So my favorite part is definitely the face-to-face time and being able to share what I find most valuable in our platform.
What is the hiring process in finding coaches for your app? And are they also like mental health professionals?
Yeah, I know coaches can be a term that may not be tied to a lot of credentialing, but we kind of changed that story here with Saluna. So our coaches and counselors are both available to talk to as mental health professionals on Saluna. Our coaches do come from a variety of backgrounds. They go through a rigorous hiring process with our team, are background checked just as any employee would be, and they must come from a variety of backgrounds. They may have a bachelor's or a master's in a behavioral health related field like psychology or social work. They may have experience as a community health worker. They may be a certified peer support specialist or a substance use disorder counselor. But no matter what background they come from, they are all supervised by a clinical professional. So they're making sure they're getting trained, staying up to date, and providing the highest quality of care.
Got it. So on the app, there were myth and fact cards about different mental health topics. So would you say that there's a lot of confusion on mental health even in 2026?
Yes, I definitely think so. The myth and fact content on our app is probably some of the most fun if you want to keep exploring in there. But even when I started this role, I started remembering from when I was teaching that mental health is a spectrum. It could look like you're having a really great day. That is still mental health. Whether you might be sad or needing a moment to yourself, we want to look at that as just navigating your day-to-day and not having that stigma of mental health always needs to be bad or negative or poor. Just as physical health, you want to go to the doctor, you want to eat well, exercise. That's things that you're doing to ensure you're having good physical health. And you want to do the same for your mental health, whether that's going for a walk, talking with friends, or putting on your favorite song when you're in a bad mood.
I love doing that. I love listening to music. So what is that your favorite part of the app, the myth and fact cards?
I think so. I like exploring those things and just learning a little bit more, because it'll tell you if you're right in your guess, if it's a myth or a fact, and kind of gives you a space to access content that's similar to social media. But the nice thing is that it's all written by our clinicians. So you're getting real information that's up to date, research backed, and evidence based.
I know you talked about how important this is to you, but do you think having digital access to mental health is beneficial, especially for teens?
Yeah, I was thinking about this, and I also want to put it back on you too to share a little bit once I say what I'm thinking. But just from my experience, wanting to ensure that people have access in a way that fits their schedule, their day-to-day. For me, I think sometimes transportation can be a big blocker, or insurance may be a big blocker to getting support that you need. So this provides that first step. Maybe there is longer term things that need to happen, but this is that initial understanding that you have support. But I'd love to hear from both of you too, if you think having a digital piece that can connect you is important.
I think it's important because personally, and a lot of people, I feel like definitely in 2026, my phone is always in my hand. Obviously not in class, when I need to put it down, I can, but I'm outside, it's always on me no matter what. So it's easy to just pick it up and be like, okay, let me go on here and then let me check this. So I feel like having an app, especially that's focused on mental health, it gives me something that, like you said, easy to access. And since it's already in my hand, I can just go to it and it's I'm feeling down, and yeah, so I think it's a really good way. I agree.
Yeah. I would say the same thing, because especially I see on YouTube, those ads for YouTube, it'll be yeah, this is a free source for you to get help, and then it's backed by a paywall. So I think it's very nice to find a free way to actually get help for people who need it. Because I always try to look up meditation apps or relaxation apps, and it's always yeah, you have to pay a monthly payment to relax here, so you have to find somewhere else. And I'm happy that there's an app that I can download where it's free and I can actually find a place to ease my mind.
Right. No 7-day free trial, $5 a month, none of that.
Yeah. Well, thank you for joining us, Ms. Cohen. It was nice talking to you.
Yes, likewise.
Okay. Thank you for listening to A Social with a Side of Justice.
We hope today's conversation helped you think differently, learn something new, or feel more connected to the issue of mental health and access to care.
Join us next time as we continue the conversation.
Because justice starts with understanding and change starts with conversation.
And if you or someone you know is struggling, you're not alone.
You can call or text 988 to reach the Suicide and Crisis Health Lifeline anytime. It's free, confidential, and available 24/7.